Hey, I'm so excited to have Dr. Weis back in studio. We are talking about November being COPD Awareness Month, and while it might leave you breathless, right now is the perfect time to talk about our lung health. Dr. Weis, the Regional Dean for the Texas Tech University Health Science Center School of Medicine, joining us now. Tell us a little bit more about, for those people at home, COPD and what that means.
First, I say I miss Hastings. Favorite store in the world, absolutely. So
you bought a few albums there. I know how much you love music.
Yeah. So COPD stands for chronic obstructive pulmonary disease. So it's a family of conditions. The most well-known are asthma and emphysema. Okay, and the reason it's called obstructive lung disease is it obstructs the flow of air out of the lungs. Okay, so these people actually what we call it trap air in their lungs, and it makes it very difficult to breathe. And so the way to think about it is some people, particularly with emphysema, will actually form almost like a balloon in their lungs, where the air is just trapped. And you imagine that balloon occupies space, and then the healthy lung can't move very well. So this is what gives them that sense of shortness of breath and not being able to breathe. There's sometimes what we call bull-eye, or these balloons.
In terms of what is something that we can look for where we're thinking to ourselves about our lung health when we need to? What are the symptoms that we're looking for?
Well, the biggest thing is I think people need to understand the risk factors for COPD, particularly emphysema. Smoking tobacco products is probably number one. Okay? But people can also have industrial exposures and things like that. But the biggest thing is shortness of breath. And it usually starts with shortness of breath with exertion. Maybe you're going to walk up that flight of stairs, and by the time you're out at the top, you're bending over trying to breathe. And then it gets worse, to where you can't even walk across the room without being short of breath, ultimately to where you're short of breath all the time, even at rest. So we want to catch it early if we can.
How early are we talking about here?
I mean, the minute someone starts going, it's time to be seen. Someone take a look.
What do you do for it?
So it's interesting, there's all kinds of medications, inhalers, things like that. But it's kind of interesting, and we notice those balloons that sometimes they form. Well, years ago, they used to call what's called lung reduction surgery, where surgeons would open up the chest and take that balloon out. Right? And hopefully that would allow the good lung to expand. Right. That was a messy surgery, not very well tolerated. We have a doctor now, Dr. Sigler, one of our lung doctors at T2HSC, who's involved in a really novel study where they're using a valve, and he can use a scope and put a valve in one of the airways where that balloon is, and that valve allows air to come out of the balloon but not go back in. Really? So it actually deflates that balloon with that valve, and that way now the lung can expand. Beautiful stuff. It's called a Zephyr valve, and he's had a number of patients receive this, and they feel better literally within hours sometimes of having this procedure done, and it allows them to get back to being able to walk or play with their grandkids, stuff like that.
Those people who are still smoking, that is a big, huge risk factor with this, isn't it?
Yeah, and that's the one is, again, not everyone who smokes will get emphysema, okay, but everyone's at risk. And then it's just looking for those early symptoms, because the sooner we can jump on it, hopefully we can prevent that long-term progression. All
right. Well, Dr. Weis, we appreciate it. Where can people go to learn a little bit more?
Well, you always go to the Texas Tech website, t2hsc.com. And then certainly if you are someone who has COPD and you want to be evaluated for this, have your doctor refer to Dr. Sigler at T2HSC, and he can certainly evaluate you for that that valve.
And the thing is, catch this stuff early on. My mom passed away from it, but at the end of the day, that's really what did it for her. So please do me a favor. If you're having these issues, go over there, check it out, get a doctor. Early detection, we always talk about that being key. So do what you can. Your life is incredibly valuable. You're worthy, so make sure you get it checked out. We got more Studio 4 on the way after this.